Okay. Good morning, good afternoon, good evening. Let me share for a moment my screen, 1 second, to start this very important webinar. Okay, we are ready to start. So welcome to the global launch of the Call for Action and Campaign From People to Leaders, Act on AMR Now. My name is Pilar Ramon Pardo. I am the Chief of the Antimicrobial Resistance Special Program at the Pan American Health Organization. We are the regional office of the World Health Organization, and I will introduce today's event. Today is important. Today's launch is a milestone because we are building on the Latin American initiative empowering community to tackle antimicrobial resistance jointly with REACT, and we are facilitating the collection of key asks from communities and civil society worldwide as part of a call for global action. This online event is an opportunity to learn more about this global campaign and add your signature to endorse it. The signatures to be collected, we will explain later a little bit more, but will be submitted along with the ask to the member states attending the UN General Assembly high-level meeting on AMR in 2024, this September. So thank you so much for giving me the opportunity to address a crucial global health challenge, antimicrobial resistance. This issue, while complex, touches each us deeply. AMR happens when microorganisms like bacteria and virus evolve to resist the medication designed to eliminate them, complicating treatment and elevating the risk of widespread disease, severe illness, and death. We know that there is an estimated 4.95 million of deaths associated with antimicrobial resistance, and that was estimation correspond to 2019, including 1.3, almost 1.3 millions of deaths attributable to bacterial antimicrobial resistance. Of course, behind these numbers, there are real people. They are mothers, fathers, sisters, brothers, communities. Now is the opportunity for communities to be listened, to join forces, to offer their point of view, their perspective, their priorities, and to embrace their accountability. We know that this situation, antimicrobial resistance, is aggravated, especially in the last 2 decades of the 21st century, by different economic, social, and political contexts. This is everything, this aggravating the crisis of antimicrobial resistance. And on the other hand, we know when is and how is the effective response. We will need this kind of coordinated response from all parts of the society under one health approach. We need evidence-based interventions. We need sustained investment in healthcare infrastructure, increase the access to diagnosis and antimicrobials and new treatments, and prioritize antimicrobial resistant policy and regulation on the use of antimicrobials. But today, we are not going to speak about the response from scientists, healthcare professionals, policymakers. Today, we want to focus on a fundamental yet often overlooked aspect of this battle, the role of the communities. Communities have a role to play. First, communities are essential to promoting education and awareness about antimicrobial resistance. Knowledge is power, and informed individuals can make choices that curb the misuse of antimicrobials. Communities, as well, are instrumental in promoting practice that prevent infection spread, such as maintaining good hygiene, implementing proper sanitation, and ensuring vaccination are up to date. This action reduces the reliance on antibiotics, thus slowing down the development of resistance. And as well, communities also contribute to AMR surveillance and research by engaging with health initiatives and supporting research efforts. Community data can provide insight that are crucial to understand and combat antimicrobial resistance. Communities provide essential support networks for individuals dealing with drug-resistant infection, ensuring that patients have access to and complete the correct course of antibiotics is fundamental. And as well, communities have a strong voice in policymaking. Local advocacy is vital for regulating antibiotic use in agriculture, a significant factor in propagation of AMR. By pushing legislation that restricts the non-essential antibiotic use, communities influence broader regulatory reforms. And it was already stated since 2019 when the UN Interagency Coordination Group in the report, they noted that civil society groups have a particular and important role to play in the development of the antimicrobial resistance national action plan. So this role has been a long time recognized. And as well, we know, as I mentioned before, we are building on empowering communities. This is a collaborative initiative spearheaded by PAHO, the Pan American Health Organization, and REACT Latin America in partnership with South Center. This initiative offers a regional platform for open and inclusive dialogue on critical role of the community empowerment in addressing AMR through a One Health approach. So we are building upon this movement. But one significant outcome of this initiative was the declaration. This is a pivotal document resulting from the concerted efforts of stakeholders at the Empowering Communities platform and underscores the critical role of community engagement in addressing AMR. The community advocates for a stronger community involvement in policy-making process and emphasize the need of local action. The international political commitment is key to move forward in the agenda. In this slide, you can see the milestones that regarding antimicrobial resistance in 2014, 2015 with the Global Action Plan, and the way in 2016 when it was the first high-level meeting on antimicrobial resistance in the United Nations General Assembly, which happening, as I mentioned, in 2016, and as well will happen next year. In that sense, the United Nations General Assembly is very important because it convenes leaders from around the world to commit action and cooperate on solutions, emphasizing that the fight against AMR requires global solidarity. However, as crucial as these international dialogues are, the power of local communities in this global fight cannot be overstated. In conclusion, while the AMR high-level meeting at the UNGAD is critical to the international commitment needed to combat AMR, don't forget that the groundwork happens in our communities. From our local farms to our school, clinics, and homes, community action are integral to the global strategy against AMR. Each step we take locally fortifies our global fight, moving us closer to a future where infection remains treatable and our health system is robust. So with that, I thank you for your attention. And now, moving to our next segment, it's my pleasure to introduce to you one of the facilitators of this initiative, Dr. Andrea Caputo Svensson. Andrea is the Global Health Advisor at REACT Europe, where he contributes to the policy and scientific work with the antibiotic resistant area, with a major focus on communities and civil society engagement. Andrea, please, the floor is yours.
Thank you so much, Pilar, for the introduction and for really opening this excellent event. And before moving on to discovering more about the call for action and hearing also from our excellent panelists present here today, I would like to ask for some help sharing a video that our colleagues in REACT Latin America have been recording during the People Health Assembly last 7th to 11th of April in Argentina, where there has been the physical launch of the call for action. So please play the video, and after that, I'll tell you more about the call for action. Thank you.
Tantos mundos para andar, cada nueva realidad y un humano que transita en busca de su eternidad. Un planeta y no hay más, nuestra temporalidad las Naciones Unidas esta historia han de contar. Hablarán de pueblos sabios, su existencia y corazón, que el comercio no se impuso a su conciencia y su razón. Y vendrán nuestros ancestros sonrientes a entonar bellos cantos de la tierra que nos enseñan a amar. Vengan, lleguen, juntemos nuestras voces este día. Todos los seres de la madre tierra y de la vida, que no hay peor pandemia que el negar una sola salud sin resistencia en libertad. Vengan, lleguen, juntemos las historias este día. Todos los seres pequeños y grandes de la vida, la metáfora de guerra de cambiar, el relato del amor y la armonía de triunfar. Vengan, lleguen, juntemos nuestras voces este día. Seres de la madre tierra y de la vida, la metáfora de guerra hay que cambiar, el relato del amor y la armonía de triunfar. Vengan, lleguen, juntemos nuestras voces este día. Nueva historia este día.
Excellent. Thank you so much for playing the video and sharing with everyone picture and images from the People Health Assembly and the physical launch. Now, for sake of time, I will just move on and describe to you today the call for global action. I'll try to answer some what, whys, and also some hows. But at the same time, also we want to know when. And as you can read from our logo, the time to act is indeed now. Starting with why call for action. So why are we facilitating this initiative today? As we heard before from Pilar, in the broader context of AMR, antibiotic resistance indeed kills over 1.2 million people a year, and then cannot be solved by a single actor in isolation, but it does require a whole of society response. Over the years, we also saw in the previous slide how from the previous UN Assembly in 2016, there has been some approaches, and most of them were top-down approaches, sometimes overlooking the challenges of local communities, especially low resource settings. This year, with the UN General Assembly 2024 in September, specifically on AMR, there is a critical need more than ever to amplify voices of communities and civil society worldwide, also for accelerating the global response to AMR. I hinted at this before, but specifically also taking some text from the call for action that you will find in the text is indeed, what is the purpose? Why are we facilitating this initiative today? It's indeed for building a movement of communities and civil society representatives to call up on governments to make strong political commitments at the UN General Assembly and to recognize the important role of communities and civil society in the global response to AMR. I thought I would describe to you the process where the call for action comes from and also where is it heading. And it's important to give credit to the initiative Empowered Communities to Tackle Antimicrobial Resistance that indeed started in 2021 with the declaration, and it's been conceived by PAHO, which is also co-facilitated today, South Center, and REACT Latin America. I also wanted to describe the process, how we came to the text as it is today. Actually, everything started in November when I had the honor to be at one of the initiatives and one of the events that Empowered Communities have organized in Cuenca, Ecuador last November. And when we started discussing how can we make sure that the process and the learnings from this great initiative in Latin America and the Caribbean could also expand to other regions in the world. How can other communities and civil society in other regions can relate to what was discovered and put together for the empowered communities? So that's how we started the phase one in updating the language contained in the Empowered Community Declaration. And immediately we realized that we needed the input from those communities and civil society in other regions. And that's where the consultation process came in. The consultation process had been asking several civil society and communities around the world to provide feedback input on the language and on the asks and requests that were present in the original draft. After receiving all the inputs, which have been carefully reviewed, they've been evaluated using 4 main criteria, which is where the relevance to the aim and scope of the initiative, insightfulness, coherence, and complementarity to the original draft, inclusivity of opinion, area of expertise, regional representation, and near consensus. After that phase, there was the phase number 3 with the launch that we just saw, the physical launch in the Argentina, the People Health Assembly, and today with the global launch. Followed by this phase number 4, which will be the starting of the global campaign. And I will give you some details in the coming slides. For a matter of time, I'm not going to go through all the single requests and that are present in the call for action and invite everyone to look into the text. But what I'm going to give you today, it's an overview. So you will find in the call 10 requests to member states and their key stakeholders worldwide. What the call focuses on is vulnerable populations, equity, and One Health. I'm also proudly saying that the call is available in 5 languages: English, Spanish, French, Portuguese, and soon also in Arabic. And last but not least, today, as in the coming months before the UN General Assembly, there will be the opportunity to sign the call for action, support the campaign, and become an ambassador. But you might ask yourself now, how do I become an ambassador? So I'm going to leave a few seconds for my colleagues to pass in the chat the link for the signing page. And for those of you who are using a smartphone, you can use the QR code that you see right here. Once you land on the signing page, I also want to mention that in the top right corner, you will find this symbol right here, which will allow you to translate the whole page in all the languages that are available on Google Translate, including the form. The form is this red rectangle that you see here that contains several text boxes. And from the beginning, you will be choosing, as you can see here, whether you will sign as a representative of a community or a civil society group, or whether you will sign on behalf of yourself. What's the difference here? The difference is that once we're going to collect all the names at the end, as I mentioned before, if you're signed as a representative of a community or civil society group, the name of the community or the civil society group will be the one listed. On the other hand, if you sign on behalf of yourself, there will be the name of the individual presented. Also very important, once you have signed, you will receive a message on the web page that says, thank you, your name and your signature has been added. I also must say that, and perhaps you've already seen in our social media, that due to a technical issue between the 7th and the 16th of April, our website was not able to record the signatures. I repeat for the recording. Between the 7th and the 16th of April, our website was not able to record the signatures. That's why we encourage everyone who has signed before those dates to please sign again. Perhaps you're also wondering what's going to happen from now, and I'm not going to spoil everything because I also want our panelists to give us some suggestions and what can happen after today's launch and with the campaign, but perhaps some pointers here. You see the global campaign indeed, which will aim at unify even more voices under the call for action. Participation to key meetings and events, and just mentioning the multi-stakeholder hearing that will happen on the 15th of May in New York. And last but not least, the handover of the call for action with the names, as I mentioned before, to the president of the 79th session of the UN General Assembly. So before closing my speech, I would like to introduce to another of the facilitators and organizer of today's event, Dr. Natalie Elmeri. She's the AMR advisor at PAHO and is part of the AMR special program. Since 2020, Natalie has been leading efforts to improve community engagement on AMR under the initiative for communities empowered to tackle AMR. And more recently, she's been an expert highly involved in the realization of this initiative. Natalie will indeed moderate the panel, and she will introduce you to the panelists of today. Thank you so much for listening, and Natalie, the floor is yours.
Thank you so much, Andrea. Good afternoon, good morning, everyone. So before introducing our wonderful guest panelists today, I'd like to encourage participants connected to ask questions to the panel using the Q&A function. After this moderated panel, we'll have a short session to take questions from the audience. So it's my pleasure today to moderate this excellent panel that you will see could not be better suited for this global launch of this call for action, given their outstanding advocacy for communities and their trajectory in this area. Okay, I see that everyone, all the panelists. I don't know if Mario.
I see Mario. Mario, could you turn on your camera, please?
You turn on your camera, if it's possible at all.
Can you hear me?
We can hear you, Mario.
Okay.
If it's possible to put your camera on, otherwise, don't worry, or we'll give you. I'll do the introduction while maybe you work on that. So first of all, so we have Dr. Mario Medegan, Secretary General of the Mouvement Universel pour la Survie de l'Humanité. So in other words, Universal Movement for Survival of Humanity from Benin. As a medical doctor and public health professional, he leads advocacy efforts with West African governments and community engagement initiatives, especially targeting populations in situations of vulnerability. Thank you so much, Mario, for being here today. We're also joined today by Vanessa Carter. Vanessa became an AMR patient advocate in 2013 after surviving a serious car accident and 10 years of facial reconstruction caused by a highly resistant MRSA, so methicillin-resistant Staphylococcus aureus infection. She's a patient advisor to several organizations, including the WHO Strategic Technical Advisory Group on AMR. And more recently, Vanessa has been a designated chair of the WHO Task Force for AMR Survivors. Thank you so much, Vanessa, for being here today. And last, but certainly not least, from Aligarh Muslim University, India. Dr. Nafis Faizi is here today. Nafis is an assistant professor of community medicine, and he actively contributes to the AMR policy debates through the WHO, NGO, and quadripartite dialogues through the Antibiotic Resistance Coalition. Welcome, Nafis. So to kick off the discussion today, we're going to start with asking all three of you the same question, which is how can we better mobilize civil society and the broader public to advocate for stronger action and accountability on AMR at the national and global level? So maybe we can follow the same order of introductions. We could give the floor to Dr. Mario Medegan. Would you like to start? So how can we better mobilize civil society and the broader public to advocate for stronger action and accountability on AMR at all levels?
Okay, thank you. Thank you, Andrea. Thank you, Natalie, for inviting me to speak on the behalf of the community I work with and where I live also. I will try my best to reflect their reality and what is going on in the field. Not to be too long. For me, the best way to engage CSOs and the broader public in general is to find a common ground between their most urgent needs. I mean, in the field, most of us CSOs here around the world, we fight against poverty, we fight for women education, we fight against security issues, access to primary healthcare of quality, access to quality medicine. So once you capture their interest on those topics, it's easier to come and talk about AMR. But as long as we won't find those common ground of their most urgent needs, it's quite difficult to make them put the finger on what is important in this combat, and the common ground between what they are living and what we come and expose to them. So yeah, roughly that's what I think about the best way of engaging CSOs and community in general on AMR. Thank you.
Thank you, Mario, for this very clear point. Vanessa?
Yeah, I think I've got sort of 5 quick sort of points. I think first and foremost is that there's a major problem with understanding what AMR is, and I think that's probably the first thing we need to focus on. So education and awareness campaigns, not just through media platforms and social media and traditional media in different countries, but also community events, which I thought, as you played that video, I got a bit of goosebumps, on me, because I thought, that's the kind of thing we need to be doing, at a global level, and the whole sort of thought behind it was, bringing voices together. That's not just within government, sectors, but also within the community. Remembering that AMR is very diverse, and we need very diverse voices to be speaking up about it. And the other thing which you've actually put into your asks, your requests as well, which I thought was really good, was to engage key stakeholders like healthcare professionals, because as a patient survivor myself, one of the biggest things I found was that having conversations with my doctor, my pharmacist, and those key stakeholders could have been a major empowerment tool for me to be able to understand what it was that I needed to do, and perhaps even lead into something like advocating about it, because I got information firsthand from those stakeholders. I think also empowering grassroots movements. Grassroots movements are really hard because we usually start with nothing. We volunteers, we come together, we've got, we don't have any resources to grow our initiatives. And so that empowerment could come in a whole lot of ways, not just funding, but also networking opportunities, being able to, work with government and with other CSOs, and of course, with organizations like yourself. And that kind of leads me into the whole, thing of fostering partnerships, because Again, going back to the whole, if you work in government, you've got these different whole stakeholders. That should be the same sort of scenario in the community as well. And of course, charities and so on, being able to work with governments as well on certain things. And then to sort of end, I would say, and this is obviously going to come up because I'm a patient survivor, is to highlight personal stories. I am one person, but I can tell you in the 11 years that I've been doing this, I've spoken to a lot of people, and it just shows you that, individuals can make a difference if they are empowered. And this is why they're so important to be included. So thank you.
Thank you so much, Vanessa. And I don't want to eat up the panelists' time, but I got very excited to see that all of the points that you brought up are actually have motivated our at least the regional initiative that we are building on for this global launch: dialogue, personal stories from the community, deeper continuous engagement throughout the year. So thank you so much, Nafis.
Hi. First of all, I should thank PAHO and REACT for staying on top of this. Let me begin by saying that all of us agree that AMR is a wicked problem, if not a super wicked one. Let's not get into those semantics. 4 years ago, there was another wicked problem that we were facing. And what did civil society do? There lies the lesson for engagement. So in September last year, PLOS Global Public Health published arguably the first paper that engaged with CSO response in COVID-19 in 5 of the most heavily impacted LMICs. I was fortunate to edit this paper by Adam Levine. When the resources were stretched in most parts of the world, these CSOs navigated and brought direct medical relief, not only through PPEs, hygiene and risk communication, but also by setting up oxygen stations in some areas. The public health system was already stretched beyond imagination. Many countries utilized the existing CSOs in reaching the vulnerable. This was even true for efforts such as cash transfer schemes for the people who were forgotten in the hard lockdown. Now, during those times, the valiant efforts of CSOs was very well recognized, even in the less democratic countries down south. The channels of communication and policy intervention campaigns recognized it, and in recognition of their valiant efforts, they gave them a seat on the discussion board. Even in some countries, in the policy intervention forums, they were given a quick seat. It was not heard of. And I just wanted to draw this attention that it has started fading in a 4 years' time. Those valiant efforts, when we recognize that we cannot do without them, that sense is no longer present in many of our countries. And if it was worthy then, it is worthy now, especially because we are dealing with a very complex challenge that Vanessa was saying right now, that those stories, we don't even hear those stories in many parts of the world, despite the fact that there are hundreds of such stories. And this acknowledgement badly needs to be there. And in the REACT policy, point number 5, it's very well written that, to create resonance within those communities, we need civil societies on the table for meaningful engagement. So, yeah.
Thank you so much, Nafis. And actually, we're going to keep you for the next question and dive a little bit deeper in that direction. So how can we ensure that the global response for AMR is inclusive, addressing the needs and perspectives of populations in situations of vulnerability, including those in low resource settings?
The health relations, sadly, while CSOs and community relationships in many countries have improved, as we've seen just now in Latin American countries, in those contexts, some of the improvements have taken place. And we are already, and I was looking at the video, and we are already living a war. There's no war metaphor anymore. Health relations with CSOs have gone sour in the post-COVID era. Some have become less democratic, some have become more autocratic. Instead of engagement, in some instances, we are seeing direct delegitimization and even criminalization of some CSOs. It is not happening in many parts of the world, but it is very much happening in some of the most populous countries in the world. Now, these wide rifts are becoming a problem. And when we had a collective concern, for example, COVID-19, we were really fighting them very well. We recognize that we are not the same. We have different challenges, but therefore, what is important is that seat on the table is there. And we must also recognize that WHO, OIE, FAO, UNEP, all of them have a very different context and structure of operations as well. So those contexts also need to be taken care of, whereas arguably the World Health Organization engages with the civil society more. It's very difficult. And when I say civil society, I must also reiterate that we are talking about non-state actors which are not for profit and not the big philanthropic organizations as such. So the engagements are far lesser with the OIE and FAO, and therefore this becomes a very complicated challenge. But the first thing that we need to do is we need to legitimize the collective concern that where CSOs have a direct role to play. Yeah.
Thank you. And maybe we can ask Mario the same question. Mario, I'll repeat the question for you. How can we ensure that the global response to AMR is inclusive and addresses the needs of people in situations of vulnerability, including in low resource settings?
Thank you, Natalie. First of all, for the response to be inclusive, the solution, the designing of the solution themselves need to be inclusive. You know, first of all, starting for the mapping of the challenges in the field. It is completely pointless to still at the high level and assume what is going on in the field. We need to reach out to the very last beneficiary. Last week, I was in Niger for such an evaluation, and we are still facing climate change issues, access to electricity, access to clean water. So as long as the solution won't be designed for those people, directly for those people, and also the process won't be monitored regularly and on a continuous rate, it would be hard to ensure that the response we are giving are inclusive. So yeah, for me, we need to reach out to the very last beneficiary and keep our eyes open on what is going on in the field on a daily, what are their needs, what are the challenges they are facing, and even the health professionals, what they are facing on a daily. That my insight in complementary with what Nafis just said, that's what we need to reflect on as well.
Thank you very much, Mario. That's very clear. So we're going to move on to the third and last question, and that's for all three of you. Maybe we can start with Vanessa. How can communities and CSOs in different regions and contexts influence governments, harnessing the call for action that we're talking about today in the lead up to the UN General Assembly high-level meeting on AMR?
Yeah, great. Thank you so much. I think one of the biggest things, like I said earlier, was definitely to build partnerships, because, you know, by doing that, we build a collective voice. That's really important. Yeah, I think that, you know, also one thing that I've found as a patient advocate is having the opportunity to be able to participate in government dialogues at more of a local level. You know, so for example, I work with the UK Healthcare Associated Infections Ministerial Group, and that little bit that I can contribute, you know, contributes to something bigger. So, you know, so I think that's probably a good starting point, is for local governments to actually realize that, you know, our voices do matter to these, you know, that sort of context. And also finding solutions, you know, like Mario was saying, when you design interventions, you should be working with people on the ground to do that. You know, in 11 years, not much has changed a lot's changed, but not much has changed, if you want to put it that way, from when I first started advocating. And I think it's because it's very difficult to understand exactly, what people need on the ground, to be able to tackle this very complicated topic. So, yeah, and I think also, CSOs can help to monitor the progress and keep government accountable, in terms of what their promises are and where we are right now.
Thank you so much, Vanessa. Nafis?
I'll draw on Vanessa's point, and let me reflect on the state of public information. Let's use antibiotics do not kill viruses as a tracer indicator. Everyone wants to know a clear message. Thailand, one of our success stories, Greece, Japan, they report that only 22% of the population pre-pandemic knew that antibiotics do not kill viruses. Only 22%. And we are not talking about, we're talking about Japan and success stories such as Thailand. More recently, IDDO and WHO researchers came out, and they say that 43% Europeans incorrectly think that antibiotics kill viruses. And most of this knowledge is only from doctors, where there is trust, and we know why this is happening. So I double down on Vanessa's point that the success stories should come from patients. Of course, we discussed this in Uppsala Dialogue last year as well, is that our language is very complex. But I want to draw the point that there was a rampant misinformation infodemic during COVID-19. It still continues unabated. But even then, the CSOs were able to send messages such as mask wearing, social distancing, which mask, how to wear. These are super technical problems as well. But we did a good job because the civil societies were involved. The problem actually is on our sense of urgency to respond to antimicrobial resistance. And we must realize that this isn't a problem that will strike us in future. It is striking us right now. I and a lot of my colleagues, almost all of my colleagues working in different hospitals in India, have seen colistin resistance among patients, hard reports on our own palm of the hands. We're talking about colistin resistance. And despite that fact, colistin oral suspension is freely available in the market for pediatric consumption as well. So the problem is far more grave. And therefore, I think that the HLN is a good platform to recognize that this is a problem that we are currently facing, and the scale is really, really increasing. So yeah, that's my point. Yeah.
Thank you, Nafis. Mario?
Yeah. Okay. The question is well designed. The question, I like the question because it states, how can communities and CSO in different, the word different is important for me, regional context, influence governments. So it's important for us as CSOs and the representative of the community, we speak on their behalf. So to influence our government, it's important for us to let our government know that as long as we won't be part of that global call to action, of that global movement, we can't going on working just at our national level. It's important to work at the global level. It's important for us to let them know that. And for example, the example of the COVID-19, AMR has no borders, no frontiers, no country. You can implement the best solution possible at your national level or your sub-regional level, but as long as you won't be part of that global movement and try to see the problem globally, it will be very difficult to reach our common objective. So the need to emphasize on that, the importance of the global movement is what we need to do as CSO in our daily advocacy effort toward our governments. Yeah, thank you.
Thank you, Mario. And because we're doing great with time, I'm actually going to pick your brain with one last question. This is for any one of you three who would like to answer. And it's about the challenges and opportunities that you see in fostering intersectoral collaboration and a One Health approach to AMR. We know this is much needed, but also very complicated in practice. So what are some of the challenges from the CSO and community perspective that you see, challenges and opportunities in improving this One Health approach and intersectoral collaboration, bringing together human health, animal health, environmental sectors, etc.?
Yeah, thank you. Can I go ahead?
Yeah, of course.
Yeah, I've participated in so many meetings where we took time to reflect on this specific question. And my personal thought is our biggest opportunities are also our biggest challenges at this point, because we have so many skills and resources, knowing that AMR reunites so many different sectors. So we have so many human resources, we have so many skills, but the challenge is that about coordinating those efforts. How to put all those skills, all those different specialities together and speak the same voice. Most of the time, human health is also work tend to work in separately from the other sectors, but we need to work together. That's the main challenge, how to coordinate our effort so that we won't waste them, so that we won't duplicate them, and so that we won't implement the same things one after the other. Thank you.
Thank you, Mario. Any of the other panelists would like to add anything?
Yeah, I could say something small. I'll keep it very simple. I think that when we talk about AMR, it's a massive mountain, isn't it? It's a massive, and but when we look at exactly what AMR is, I'm just going to use my personal experience, MRSA. MRSA is a quintessential One Health issue. And it's a little bit easier to say, okay, MRSA is happening and, you could get it from food, you could get it in the hospital, you could get it. So, so things like kind of, monitoring it and teaching people about that and so on is just one tiny little piece of the puzzle. But, but again, going back to, we're trying to tackle this massive mountain, and we should also be looking at, working in One Health, tackling these smaller sort of things. And I'm sure it's already happening. But yeah, that to me would probably be, I don't know, maybe one of the ways to go about it. Because I've always found that I've always been in conversations in terms of AMR, in terms of like only, human health. There's, very few times that it kind of crosses over. So, yeah, so I would say start small and work your way up is the point I'm trying to make.
Thank you so much. Well, yeah, Isabella is letting us know that time is up for this section. But thank you so much, Vanessa, Nafis, Mario, for your very valuable advice and insights that we will certainly take into account for the next steps for this call for action. I think we are going to move on to taking questions from the floor. Andrea, do we have any questions from participants?
Hi, everyone. And again, excellent conversation and thanks. And I also see excellent questions in the Q&A, and I'll try just to select a few. Some of those have already been answered, so we're not going to repeat that. But some others, perhaps some of our panelists might have some insights on it. So Stella Nanyonga, I hope I'm pronouncing correctly, she's asking, we talk about political commitment in AMR, but what does this actually mean, and can it be measured? I guess also reflecting on targets, measurable targets. We know there is a lot of discussion ongoing with different set of targets, but I'll leave to any of you also with your personal experience, what does to you mean political commitment in AMR, and do we know the best way for measuring it? I guess that would be the question. Any of you could feel like answering? I see Nafis.
Yeah, That's a super question that I see here. Let's think about it simply, and then this is something that we see in India, and India is a huge country. So you pick up a country down in the south, Kerala, and then there are state action plans. So India made a very good national action plan as soon as everybody was making. We are very good on paper. Nobody can mess around with papers in it we make brilliant papers. But what happens in Kerala, which has a legacy of more constructive engagement with civil society, that it became the first state to have a state action plan as well, which was concrete, which was dependent on their strict context and understanding the nuances of their own health system. They had a very good intersectoral engagement that Mario was talking about, which is very difficult. But when you compare it to North, even in a rich state like Punjab, that is badly missing. What I really want to point out here is the measurement could start from as simple steps as input and output. How many civil society members were there on the chair when this particular national action plan was implemented? And they are all very well highlighted, even in the 5 objectives that we see in the global action plan that led to the national action plan. But the action on ground is missing that engagement in the sense of a meaningful response. And even within countries, there are good examples and bad examples, just like I mentioned. Yeah.
Thank you so much, Nafis. I see, Mario, you have unmuted yourself. Go ahead.
Yeah. I would join what Nafis just said. It's quite a long process to try and measure the political engagement, since national policies are at the lowest level, the lowest length of national policy are 10 to 20 years. It's hard to measure it, but at least on a yearly basis, we can try and measure how the importance, the political level, our government, the importance they give to CSOs. Because at the end of the day, CSOs are the bridge between communities and the government action, the government decision. So the importance they give, the place they give us on the table of decision making, we can measure that they are willing, that they are really strong will to change things. That's what I wanted to add.
Very, very valid point. Thanks, Mario, as well. Should I go on to the next question, perhaps, if Vanessa don't want to add anything here? So another question here, I think is also very relevant and is asked from Peter Owiti. And I'll read the questions and then I'll see who can answer. My name is Peter Owiti from Water Youth Development Project in Kenya. I come from agriculture background. My question is on the modalities for the multi-stakeholder hearing. Are we going to have side events and consolidation? I've been in previous hearing for TB, UHIC, PPR in New York. We need that solidarity in community voice. What are the level of participation in hearing and main declaration? It's a quite, I would say, complex and wide question, but at the same time, perhaps I would also add on to like how can we learn from what has happened perhaps before when it came to community engagement for maybe other areas like TB and UHC? How can be done anything different this year? And yeah, perhaps also some more insights on the multi-stakeholder hearing, whether indeed there would be opportunity also for communities and civil society representatives to participate. Does anyone want to take this question?
So I would refrain from the multi-sectoral part, but learning from TB and HIV, it is important to recognize certain differences. Most of the TB and HIV successes that we have had is because TB and HIV were dealt with like a vertical problem, vertical program, which the AMR cannot afford to have. For AMR, the universal health coverage provides the best enabling platform for stewardship. So stewardship and optimization can be best done in a stable, functioning health systems. One can't fine-tune a string that is already broken or non-existent. So therefore, it is not also about the HR capacity alone. So, for example, recently we saw how Bhutan, one of the few countries that has reduced its meropenem resistance by enforcing a very good tazobactam piperacillin first policy. So you have to use this first, and then only you'll use this. And therefore, they have a success story where our colleagues from Bhutan tell us that they've reduced their meropenem resistance. But they could do that because they had a stable health functioning system and they knew how it would operate. It's not about the number of doctors or health workers. It's about the health system, health services provisioning architecture that they have. So therefore, they could respond better. Similarly, if you compare Thailand to the other countries, which are similar in terms of human resources, you would see that the stable health functioning system where you can actually predict what is going to happen, there you can optimize things, then you can have stewardship policies a little better than the others. Of course, I'm talking only from an LMIC centric point of view. So yeah.
Thank you so much, Nafis. I also see another question here for Vanessa specifically. I translated this from French, so I'm hoping that interpretation is correct, and I'll try to give you also my look into the question. I think they're referring, Ibrahima Kauma, she's referring to your experience in South Africa, and basically how were you be able to get in contact and be heard. The translation is by authority in South Africa. What has been your perhaps experience there? How can other patients also perhaps relate to that and in that situation? Thanks, Vanessa.
Thank you so much. Yeah. So I mean, I was in South Africa, Johannesburg, for my whole life. Just to give you a bit of context, and I've only just moved to the UK in 2020. So I've only been here for 4 years or 3.5 years. There's a huge difference. There's a massive difference between the way that the UK government does things and the way that the South African government does things and the way that things just operate. And I think that there's so many elements to that. It's funding being available. It's commitments to other more urgent things. And it's a lack of resources. I think in South Africa that makes it really much harder to advocate there. And something I wanted to say earlier as well was, when I was talking about diversity of patient voices and diversity of communication, was in South Africa we have 11 official languages. In England, most of our language goes out in English. So I guess to keep it kind of culturally sensitive, and not just in terms of language, but also health literacy. There are huge barriers in South Africa. So I think that some of the conversations that have come up have gone around that. They've really spoken around, like, how do we communicate this with the communities? How do we mobilize action and so on? So I think that in every country we need to be really, really mindful of that. And for example, if we're talking about RPC, are we being mindful about the fact that people have access to clean water and sanitation? And really involving those communities to be part of the solutions to tackling it. But yeah, as I say, I've lived in both countries, higher income, low middle income, and there is a huge difference. I think that for me though, starting out there was just a case of that light bulb moment that said, oh, I have antibiotic resistance. What is that? And I think it was just in my nature to say, I need to advocate about this because I don't understand why this is not common knowledge. And it doesn't mean that everybody's going to do the same. It doesn't mean that everybody's going to have the time commitment or resources to be able to do that, but at least it's a starting point, I think, in terms of communication, to get us in the right direction.
Great. Thank you so much, Vanessa, for providing here your experience. Yeah, I see maybe we're out of time for questions from the audience, I believe. Yeah, so I'll leave it to Natalie for the last bit, and then Anna. Thank you. Thanks for today.
Thank you so much, Andrea. So now it's my pleasure to leave the floor to React Europe Director Anna Karine Sjöblom for the concluding remarks. Anna is a registered nurse with a long experience, both hands-on work and humanitarian programs, and policy and advocacy work. Before joining REACT Europe as a director in 2022, Anna worked with Médecins Sans Frontières both as a nurse and medical team leader, and as a medical humanitarian advisor and part of management teams. Anna, the floor is yours.
Thank you, Nathalie, and thank you all. It's been a really lovely and inspiring hour that we had together, and I really enjoyed reading the comments and the questions in the chat. I hope that we can save, because there were some concrete ideas there also on how to ask for more AMR-specific content in university courses, for example. And that reminds me on the need to engage youth and students in this work. But I have the honor to thank you all, and on behalf of REACT and PAHO, to everyone who joined, and also for people who work together with this with this launch, musicians, technicians, and everyone else. We have, during this hour, heard perspectives both from Latin America, Asia, Africa, and Europe when it comes to different kinds of work that's been taking place outside of agency, governments, and institutions, but by people. And this is truly impressive. But we also heard of several of the challenges that we are encountering in this work. We heard from different kind of perspectives as well, from both like healthcare advocates and from patient perspectives. So these are just examples of groups that we hope that this call for action can be relevant for to engage with. And I hope that you all on the call can help us to identify the others. And as Nathalie mentioned, I'm a nurse as a background, and in my work in healthcare services and hospitals, I've met patients of all ages, sometimes not older than a couple of days old, and sometimes older than 100 years old. But that is common, that they actually face with a life-threatening bacterial infection. And you can see, like on a daily basis, the importance of effective antibiotics. They are the difference between life and death. And when those infections are getting more and more difficult to treat with the available antibiotics, this is truly challenging, and it's really upsetting as well. I've also been in situations where patients got sick from acquiring infections during the time that they spent in the ward that I was working. And when we were able to uphold the IPC measures, the infection prevention and control measures, or when the resources to have this in place, this infrastructures was not accessible. And in this situation, I think it's clear that, this is an issue that is about equity also. So I think there's like nursing professional associations, as well as many others, also need to engage in this work, as they already do. But I think this is just an example of where this call for action can become relevant. We have been presented also by the content of this call, and I'm actually truly convinced that all changes in society starts with people. It starts by people being the change, and also people demanding the change. And we have 5 months up to UNGA, and a lot can happen between now and the high-level meeting, and these months are key. We can maybe think that one meeting does not change so much, but it's giving an opportunity not only for member states to decide what they want to obtain, what they agree on, what targets, make commitments, but it's also an opportunity for many others to come together. I think also this meeting, for many of us, we feel like it is really the moment when we can perhaps, and hopefully we have to, come across to global leaders what the magnitude of the problem that has not today yet been realized, but with the widespread pain and suffering that difficult to treat bacterial infections are increasingly causing to people, animals, environment, to global economy and societies. So for PAHO and REACT, we work to facilitate this call for action for some months now. It's not really our text and our call, it's really by contribution from civil society and communities out there. And we want to continue to do this. During this startup phase, we've been engaging with different groups and different individuals who really want to work together with us on this. And we hope to make these, broad sets of voices also visible during UNGA, that they know that it is present and that it's noticed by member states and by leaders that the crisis with antibiotics and with AMR is something that people care about, so that we all are present during this meeting somehow. We need to figure out how. So for REACT, this is a continuation of a work that started a long time before this work. We've worked with identifying ways of addressing antibiotic resistance on local level, for example, through antibiotic smart communities pilot in India and Indonesia, through different parts engaging with society and youth in Africa. And we worked with different sectors of society also in Sweden, and through the Empowered Communities Initiative across Latin America. And we opened the session today, or our meeting today, with people and music, and would like to end it in the same way. So from the song from REACT Latin America, we'll now visit the team of REACT in Africa. This is actually an example, an excellent way of how you can use voices in health promotion and in getting messages across. So from Matiro Hospital in Zambia, there is a group of women that together work with REACT Africa on ABR literacy program. And what we're going to hear now is one song that they will sing for us. And also, I would just say before, while we get this video ready, that also this group actually wrote a specific, together with Sarah, the community engagement officer in REACT, they actually wrote a text and showed with pictures exactly like what the themes in our call for action actually meant for them locally wise. So like tangible examples on the different content of the call for action. So I think that was something, that kind of examples is something that we welcome more of. So please share your story, and like the panelists said, is through that also that we can obtain change. So I think with this, I would like to thank you all again for joining our webinar and our launch for global action. And please stay in touch and help us spread the call. And yeah, see you soon again, hopefully. Thank you very much.